This is CBC Vancouver News.
Hi there, and good afternoon to you. I'm Mike Killeen in the CBC Vancouver newsroom. And thanks for joining us online this afternoon. And this is going to be where you'll find CBC Vancouver News during the COVID-19 pandemic. At CBC, we've decided to temporarily consolidate our news programming, redeploying our resources to ensure the most robust coverage. So, CBC Vancouver TV hosts, me, Anita, Dan, and Leanne, along with our news content, are being integrated into the overall coverage on CBC News Network. So, if you're tuning in on TV at 6, 11, and on the weekend, you'll continue to get a full picture of not only local news, but also national and international coverage powered by the entire news team at CBC. Right now, though, we've got your local news online, so let's get right to it. And we begin tonight with the latest on the coronavirus crisis here in BC. First, there are no new deaths in our province, but Provincial Health Officer Dr. Bonnie Henry is reporting another jump in the number of cases. CBC's Tanya Fletcher is here with the latest on this. And Tanya, we were expecting a jump in cases.
Yes, and Mike, that's partly because of the ramp up in testing. Now, we did see today another 45 new cases, but you did mention that good news, no additional fatalities since yesterday. Health officials say we are at a critical point, though, in this cycle of the virus. That's because we're dealing today with cases that spread up to 2 weeks ago, maybe before those symptoms started to show or those cases started to be tested. And so she says the measures we take today could help curb the number of cases we see 2 weeks from now. Now, it's through Dr. Bonnie Henry's orders that we slow that spread, social distancing and gatherings of fewer than 50 people. And she emphasized today that it's key that essential services continue to operate. So businesses will have to use their own discretion on how to tailor these new parameters to their own workplaces.
For some people, the social distancing requirements, making sure that there's at least 1 to 2 meters around people in your business. If you're a grocery store that's a very large one, that may mean that you can accommodate several hundred people without them having to come in close contact with each other. If it's a very small business, it may have to be one at a time or very few people.
Now, she also suggests the province may need to work to minimize the number of people on public transit to abide by these new measures. And it's interesting, Mike, out and about today, I was walking through Yellowtown on my way to work, and I saw some of the businesses starting to abide by these new measures. Take a look. This is a bakery in Yellowtown, and you can see that they've got the door open, but staff have physically moved the front counter up to block the entranceway. That's so nobody can physically walk in through the door, but they can still deliver those goods and services. Here's another sign. You can see businesses are really starting to take this seriously. COVID-19, takeout, delivery only. They list the options there. So the message is starting to get through. You can still remain open if you're a business as long as you're able to operate within those parameters.
That's the new reality we are all dealing with, for sure. And today, Tanya, BC declared a public state of emergency. So how's that different from yesterday's declaration of a public health emergency?
We talked yesterday about being able to cut through that red tape more, and today's designation does that even more so. It makes sure that federal, provincial, and local resources are delivered in a joint and coordinated way. So it really streamlines the delivery of these the help that's coming. So here's BC's Public Safety Minister, Mike Farnworth, explaining what else that entails.
The declaration also includes the means to secure critical supply chains, to ensure people have access to essential goods and services, and that any infrastructure necessary to support the response to COVID-19 is readily available.
And we should emphasize as well that he says the supply chains are at a good point right now. There's no need to hoard. And the emergency designation, by the way, gives the province power as well to immediately enforce the orders given by BC's top doctor. So if anyone is flagrantly, abusing or not following those instructions, if they hold, big wedding parties of hundreds of people, Farnworth says they can be made to abide, i.e. police enforcement. And also, just to mention, House leaders of all three parties have agreed to briefly resume the legislature next week with a minimal number of MLAs. So Monday we'll have the Speaker, 2 Liberals, 2 Greens, and 7 NDP. They'll reconvene to fast-track some emergency legislation, specifically to bring help to workers. Mike?
All right, Tanya, thanks very much. Tanya Fletcher with us live on this story tonight. Now, we know you have a lot of questions about the outbreak. So as we've been doing for the past few days, we once again have a doctor on standby with some of the answers. Dr. Iris Gorfinkel is a family physician. She's going to be joining us in about 10 minutes or so. So if you have questions, be sure to call the number on your screen there or send questions in via email. Of course, if you're watching us on one of our many live streams this evening, you can also post your questions in the comment section and we will get those to Dr. Gorfinkel. Well, as the province announced a state of emergency today, so did the city of Vancouver.
After taking the best advice from health officials, Fire Chief Darrell Reed, and Police Chief Adam Palmer, I have decided we need to declare a state of emergency in Vancouver.
What this all means is the city has a wide variety of powers it can immediately enact, including closing all restaurants indefinitely to in-person service, something Mayor Kennedy Stewart says businesses should prepare for.
Right now, the focus must remain on helping our most vulnerable stay safe, making sure no worker is left behind and no one loses their home, and doing right by the thousands of businesses that are reeling right now.
Stewart says a part of the reason for declaring the local state of emergency was that some people and businesses are ignoring Tuesday's order to shut down restaurants for the day. He also says the city will request aid from Ottawa and the province to help its most vulnerable residents. Now, one of the new COVID-19 cases being reported today is at a care home in downtown Vancouver. It has implemented outbreak control measures after a resident in the special care unit was diagnosed with the virus. Vancouver Coastal Health is working with staff at Harrow Park Centre to identify anybody who may have been exposed to coronavirus. It's estimated 180 people are now confined to their rooms in the assisted living and long-term care facility. Meals are now delivered, cleaning procedures are being ramped up, and visitors are limited. Well, moving on to the federal response to this pandemic as the virus spreads, there are now about 650 confirmed or presumptive cases of infection across Canada, and the economy has taken a particular hit as businesses close. Well, today, the Trudeau government unveiled an $82 billion emergency response package to try to help support those in need.
We'll provide $27 billion of direct support to people and businesses, which is more than 1% of our GDP. On top of this, we'll defer $55 billion in tax revenue, leaving that money in the economy. For all Canadians, this means we're doing whatever...
The response means tax deferrals and wage subsidies for suffering businesses, income support to help Canadians pay for rent and groceries, a temporary boost to child benefit payments, and an interest-free temporary reprieve on student loan payments. It also means an extension on filing deadlines for personal income tax. The package will need legislative approval, but there seems to be confidence the measures can be quickly passed. And new and extraordinary measures are being brought in to try to slow the spread of COVID-19. The latest, the temporary closure of the Canada-US border to all day trippers, sightseers, holiday goers, and shoppers. Border crossings were pretty quiet today as news spread of the impending closure. The CBC's Megan Batchelor was at one of those crossings.
Here at the Peace Arch border crossing, there were more people taking in the sights, trying to see just how quiet it was after Prime Minister Trudeau's announcement that this border would be closing. But there were some Canadians still risking crossing the American border in spite of that impending closure.
No 14 days into self-isolation when you come back.
Oh, yeah.
Crossing the border while he still can, but just under the wire.
Travelers will no longer be permitted to cross the border for recreation and tourism. In both our countries, we're encouraging people to stay home.
No more cross-border shopping, no more tourism. The border isn't closed yet. Canada's Deputy Prime Minister says it could be a matter of hours or days until that happens. Until then, Canadians are making their way south in spite of the worst outbreak in North America being in Washington state.
It's very surreal, actually. Yeah, it's hard to believe. I've never seen the border like this. I don't think we will again.
Stuart Lockwood is going for a family emergency and is prepared to be stuck in the U.S. if necessary. Others were crossing the U.S. border to go home. Blake Treadway and his wife recently returned from Belize.
We're ready to get home and stay about 6 feet away from everybody.
U.S. President Donald Trump has said the closure could last 30 days.
How does all of this make you feel?
Well, I don't sleep well at all anyway, but I'm doing my best.
And so for those who did return home using this land border, they're now preparing for that 14-day period of mandated self-isolation.
CBC's Megan Batchelor reporting from the Peace Arch border crossing. And for those traveling with Air Canada, we have some news for you tonight. The carrier says it will gradually suspend the majority of its international and U.S. transborder flights by the end of the month. The airline will serve a small number of destinations from select Canadian cities after April 1st and will serve Canadian routes with a significantly reduced network. Well, COVID-19 is hammering the stock markets again with enormous losses on the Dow and TSX again today. The Canadian dollar is hovering just under 70 cents US, and it was another difficult day for the oil and gas industry. The price for a barrel of Canadian oil sands crude fell to its lowest level ever on Wednesday, trading at just over $9 a barrel. The U.S. oil benchmark also dropped to its lowest level since 2003, trading at just over $22 a barrel. Well, even if your neighborhood grocery store is well stocked, you're likely seeing pictures circulating online of a lot of empty shelves. If you're concerned about there being a lack of food or, yes, toilet paper, BC government has a message for you. There is enough for everyone. But as our Jesse Johnston reports, people are still hoarding.
Go to a supermarket and there's a good chance it will look something like this. At least that's how it looks in the front. Check the back, and there's plenty of food. For Cam Bruce, who owns a grocery store in East Vancouver,
can you hang on for half a second? I'll just check with the girls up front. Okay.
The issue is his team can't stock the shelves fast enough.
It's just a matter of physically, logistically getting it to us and then getting it to the floor.
Buying in bulk during a pandemic is understandable, especially when you see empty shelves. But the province says there's no reason to panic buy.
The Premier and I had discussions with the Retail Council, and they've assured us again that there's enough in stock right now for everyone. There isn't any need to overstock your own supplies.
From, let's say, 9 a.m. to 4.
At Granville Island, aside from each transaction being followed by a thorough cleaning, it's pretty much business as usual.
We've overstocked everything in preparation, and there's rumors coming around that Granville Island might be closed. It isn't. There's limited hours just for grocery stores.
Now, many stores are limiting how many customers can be inside at once. Some are opening early just for seniors, and others are shortening hours to give staff more time to stock shelves.
So we've had 5 days of just, ridiculous traffic. So, this today does feel a little bit calmer, so maybe I'm hoping that people have enough food. People have been buying so much food, right? That, at some point they must say, I don't need any more,
Regardless of the store, the message is the same.
All the stuff I'm getting.
Take what you need and leave the rest. Jesse Johnston, CBC News, Vancouver.
Meteorologist Brett Soderholm is here with us. Your streak is intact.
Yes.
Beautiful.
I'm really enjoying all of this nice weather, and I think you are too.
Yeah,
right?
I love it.
Lots to be grateful for. And I think I really just want to take this moment to recognize, there's so much uncertainty in our day-to-day lives, but I know that weather is one thing that I personally count on. I think you do as well, and many of our viewers. So I'm going to still be here to give you your weather forecast in Vancouver and across the province. And at the same time, if you have any questions, maybe I haven't covered something that you've always been wanting to know, I'm here for you. This is going to be interactive. This is way less formal. You put those questions out there, and I'm going to try my best to answer them. But Same time, we should talk about these temperatures because it is so nice out there, and this trend is going to be continuing. I want to show you actually our temperatures for the next little while. Look at these daily highs. So if you look down toward Vancouver, 13 degrees, Abbotsford 15, and places like Port Alberni on Vancouver Island getting up to about 16 degrees, and that is going to be the case all the way into Friday. Now, Friday is our first full day of spring. That means, of course, that spring is starting tomorrow, and our temperatures all the way across the region are certainly going to be matching that. And if you look ahead at our 5-day forecast, one thing you've been seeing throughout this whole week, if you've been following along, is that this trend of dry weather and lots of sunshine and warm temperatures, well, that's still going to be going all the way through the weekend. And yes, if you're a longtime listener, Mike and I love to joke how come Saturday, breaking with the trend here, still likely going to be a really nice and sunny day. And then after that, Sunday into Monday, that's when we're going to get into a few showers. Now, at the same time, I did say earlier that we are dealing with spring. That's going to be our first day of it tomorrow. It's happening at 8:49 p.m. And I wanted to show you some beautiful pictures that was taken earlier today by our own video journalist, Maggie McPherson. And these are just some of the lovely sights that we got to experience today. And it is certainly looking very summery. Lots of people out. We have some people doing Tai Chi, people going for walks and bike rides, and just really taking in the scenery. And I think it's a good moment to appreciate how lucky we are to have the scenery around us. And as I said, all of these nice conditions are going to be continuing for tomorrow and through the rest of the week. So enjoy it while you can.
Fantastic. You and I talked about this a bit. Allergies, I'm noticing it myself.
Exactly, and I think there are a few people right now that are starting to realize that stuff is starting to blossom. I noticed that, for example, cherry blossoms, or at least some type of blossoms, are coming out. So I'm going to look into that tonight and see what those levels are, because I think there is quite literally something in the air.
All right, and as you said, we are in extraordinary times, and people, if you've got questions about the weather, we have a meteorologist here.
I'm here for you guys.
And you're available on social media. We know how to get a hold of you, so that's fantastic. Okay, well, thank you very much.
You're welcome.
Right now, we are going to get back to something that we have been doing for the last several days here on CBC Vancouver, and that's trying to answer some of your questions about COVID-19, asking your questions and posing them to the experts. And we're going to do that again right now for the next little while. We've got plenty of time. You can ask questions over email. You can even give us a phone call or contact us on Facebook, YouTube, or Twitter. And we're already getting quite a few questions coming in, so that's fantastic. Keep them coming, because joining us now is Dr. Iris Gorfinkel, a family physician in Toronto and a medical researcher in vaccines. She was on with Gloria on CBC Radio 1 a little bit earlier, and I know, Dr. Gorfinkel, a lot of people certainly have questions. So thanks for doing this with us online this afternoon. We do appreciate it.
Thank you for having me, Mike.
All right. Well, let's go right to some of these questions here. Jenny on Facebook is asking if there's any different advice or testing protocol for people with pre-existing conditions or people who are immune compromised.
It's those individuals who are actually the greatest risk. So individuals over 60 or with chronic conditions and immunocompromised. So that's largely where we're aiming our testing. Of course, if there is some contact with someone who's at high risk, that's a major thing. The prioritization is individuals who are hospitalized and those who are in long-term care institutions. The problem is, as everybody knows, we don't have any cure or effective therapy. So that being the case, we're aiming the testing where it's actually going to make a difference to what we do.
Okay, a YouTuber user wants to know whether testing as widely as possible could help flatten the curve. It seems a large number of asymptomatic cases are being missed.
You know what? That YouTuber is absolutely right. And in fact, countries that have done that have seen lower rates. The problem is we have limited numbers of tests. We have limited numbers of facilities. We have limited numbers of individuals who are doing the tests. So unfortunately, we do face some fiscal realities when it comes to testing. But that person is absolutely right.
Okay, we get this question quite a bit. Perhaps you do as well. Questions about ibuprofen, Advil, anti-inflammatories, and the impact on COVID-19. Can you tell us about how the two interact?
Yes, I can. In fact, there was a study, but understand it was a small study, and it's considered preliminary because it was less than 100 people. But what they found is that those individuals who are on medications like Advil, ibuprofen, naproxen, diclofenac, Aleve, I'm trying to give you both trade names and brand names, generics, so you understand. These drugs were associated with having it happen at a younger age and a somewhat higher morbidity. But the problem, of course, is that what do? We always take these drugs when we're feeling sick, and the numbers were very small. But that said, we don't have a lot of great information to go on. We are hanging on to preliminary things. So the first drug of choice, if you feel flu-like, would be acetaminophen or Tylenol.
Okay, it's understandable. All right, Erda is curious to know, if one were to feel ill, stay home, then recover, what's the amount of time after feeling better that it's okay to go back to work?
Well, currently we're suggesting that if you have a sore throat, you self-isolate for a period of 2 weeks. Now, say your flu or your cold or whatever it is lasting longer than that. We want you to stay until you're feeling well. And personally, there's no hard number to this. I would add just 2 days to be safe.
All right, Cher is wondering, how are store clerks and staff not risking their health in this situation?
Well, in truth, they are. Anyone with exposure to another person is potentially risking their health. But we would hope that store clerks have access to things like hand sanitizer, and that, in fact, customers are kind of minding the gap, if you will, and staying away, trying to keep that 6 feet away. The truth is, this system is not going to be perfect. We're talking about trying to get it as good as we can.
Okay, Sandy has emailed to ask, how long does the virus live on groceries or packing of food items? Should we sanitize everything we buy? If so, how?
Not necessary to sanitize it, not necessary to sanitize the lettuce and the oranges and all that. That is not an issue. Even if it should come from China, it is not an issue. You know, when it comes to how long the aerosol lives in the air, they just published it in the New England Journal of Medicine, that bastion of medical knowledge. And what they found is that aerosolized, it lives for 3 hours. But what happens is the virus is not very hardy. It rapidly dies. So, you know, the way we contract it is largely through droplets, coughing, laughing, sneezing. So you want to that's why that 6 feet is so important.
Okay, well, let's follow that up then with a related question from a YouTube viewer. Wants to know, what's the latest on COVID-19 being airborne in some cases? Lots of conflicting reports on that.
Right, so that's just what we talked about.
Right.
We know that it's aerosolized for about 3 hours, but what we don't know is the viral load. And that's actually a big question. So what happens is that at different places in the infection, people are shedding different amounts of virus. And just how much virus a person has to inhale in order to get sick is actually not known at this point.
Okay, we had this question quite a bit from viewers. Is it possible to get the virus multiple times?
We don't know that. You know, it's interesting that we're now working on serological testing. I always find this to be kind of a minor miracle, but just from a blood test, we can tell if a person has had chickenpox, measles, mumps, rubella, and we're hoping to do the same thing with the COVID-19. Imagine you do a blood test and we can see if your body has antibodies to it. That's actually a critical piece of the puzzle to develop an effective vaccination.
Okay. Now, you specialize in vaccines. Let me ask you, how far might we be from a potential vaccine for COVID-19?
You know, conservative estimates are now at about 18 months. 12 months, I think, is a little unrealistic. I think probably 18 months. Hopefully, by that time, it will have burned out. Consider for SARS, for example. SARS, there was actually a vaccine developed, and it was never used. We just never needed it again. So hopefully COVID-19 will follow that same path, but we really do not know that just yet.
All right, Rizna wants to know, I have a newborn baby. Does she have additional health risks? And what can I do to make sure she doesn't get sick? We know that breastfeeding is effective to prevent many infections.
So there's a couple of points there. First, this is not a pediatric disease. And that's important to understand. Kids who get it, 90% of the people who get it, 80 to 90%, it's a mild illness. In other words, a person could go about doing all their regular activities. True, they'd be slowed down. True, they'd be a little tired. But basically, it's a mild illness. And all this hullabaloo is about that 5% who get super sick, the ones over 60 with chronic conditions. But as far as your baby is concerned, breastfeeding is your best bet. You're getting the flu shot makes a big difference. You're ensuring that you're protected and taking the social precautions.
Okay, we've got time for a couple more quick questions. A viewer is asking, and you may not be aware of this, but Japan recently introduced a potential treatment that usually works on pancreatitis. Could that, the viewer asks, be efficient to use that treatment here in Canada?
It's very exciting. There is so much research going on. It's actually quite heartwarming. If only the world could do this with, say, global warming. That would have been nice. But yes, there's antivirals they're looking at. They're actually looking at chloroquine. There's a number of things that potential therapies. Now, none of these are actually cures for viruses, but they may diminish the amount of viral load. They may diminish how long a person is sick. So we keep our fingers crossed.
Okay, a lot of focus on care homes right now. We've seen that develop here in British Columbia again today. John is asking, how can care aides keep social distance from our clients when we need to provide care when we're literally less than a foot away or so?
When it comes to providing personal care, there is no maintaining 6 feet. Let's face it, that's not a go, that's not going to happen. But what happens is that we're talking about society as a whole. We cannot be perfect in this endeavor. There's going to be closeness, there's going to be sex in the world, there's going to be love, there's going to be hand-holding, and that actually matters. It makes a huge difference, we know. But in the aggregate, we're talking about largely strangers, we're talking about keeping the distance if and when we can.
Dr. Gorfinkel, thank you so much for being with us this afternoon. We truly appreciate it.
It's always a pleasure.
And thank you for all your questions. That was Dr. Iris Gorfinkel, family physician in Toronto, medical researcher in vaccines. Well, as more and more British Columbians stay home to stop the spread of the virus, many community members are stepping up to help. As John Hernandez reports, they're trying to make sure those who are self-isolating get the goods and services they need.
During this time, sometimes I question what to do.
The tasting room is empty at New Westminster's Steel and Oak Brewery, but the taps are far from dry.
We all have product right now because things definitely aren't selling as quickly as they once did. I think most of us have shut down our tasting rooms, so we're not having people in to drink beer, so it needs to go somewhere. It is a product that eventually goes bad.
That's why owner Jordan Foss is going on a beer run. Today is his first crack at a new delivery service, a program aimed at getting product to people in self-isolation.
I'll take beer to you, we'll do it in a safe way so everybody feels comfortable about it, and you don't have to worry about going out if it's something that you don't want to do. And to be honest, I'm a little bit light on work these days because we're definitely not selling as much beer as we once did, so my afternoons are a little free.
He's not alone. Others around our province are also stepping up.
When you're helping, even if you don't get any sleep, you feel amazing.
Carlos Tellierdad knows just how devastating the impact of the virus can be for families. His work as a photographer dried up overnight.
Thursday, I couldn't sleep all night, and then Friday I locked myself up, and I thought, okay, I got to come up with something, not just for me, but for everybody.
On Sunday, he launched a Vancouver-based website called coronavirussos.org. It connects people in need of supplies, even emotional support, with volunteers and donors, a program he hopes will expand to even more cities.
You can't access any of the government programs fast enough. We're doing it fast. There's no breaks in this. Someone calls 15, 20 minutes later, they're helping someone else.
We're going to really understand how good people actually are and how much we do actually love and we care.
A public health crisis that's showing no signs of slowing down, and for some, there's no better reason to help your neighbor. John Hernandez, CBC News, Vancouver.
Yeah, nice to see a lot of people helping out for sure. Now, as you may have heard, our regular 6 p.m. TV broadcast in Vancouver is now temporarily being replaced by CBC News Network and The National. So coming up at the top of the hour, join my regular co-host Anita Bath as she brings you live updates on COVID-19 on The National. And you can tune in on TV just as you normally would for our regular newscast. And you can stream it on CBC Gem. Right now, we're going to end with some music. Over the past few weeks, we've heard the message over and over, stay home. Well, three brothers from Ladner have a memorable way for you to remember that message. Thanks for watching and have a listen.
1, 2, 3. If you want to go out, then you best think twice to stay home. Stay home. Keep your trust to yourself if you want to be nice. Stay home. Stay home. Wash your hands, keep them out of your face. You don't want to cause the latest case. Think of your grannies, think of your friends. Do it for the ones who can't defend. Just stay home. Read some good books, play a fun game. Stay home. Stay home. Sing a song, then sing it again. Stay home. Stay home. Wash your hands, keep them out of your face. You don't want to cause the latest case. Think of your grannies, think of your friends.